An in-house doctor opewompo. One in-house doctor. Dr. Kusi Elmenchen. Yenini edinko. Na no pay oni yenua Saibu, Abdul, Kahad, and the buyer were a physiotherapist, stroke unit, Kolebu Teaching Hospital. One no a buyer, Mama Kwala.
Yenua.
So ni so na in-house doctor.
Rasami.
We title Diama wo into some.
But Masum yeso.
Na I find say Pembe College for near I find say person for no.
You will come again next year.
Oh, yeah,
you stronger.
You be
stronger.
I was here more before it's kakra na omode.
No
feel good so omo yi. So ni so na be in-house physiotherapist there. Also in-house. Doc, it's good to have you.
Yeah.
It's good to have you as
well.
Thank you. Stroke yarebe.
Okay, stroke yarebe. When na pay be chia wahwe fo nyina so ene Ghana fo nyina so. Stroke yare bia nipa pia te ho da. Ye ka se stroke problem e koso wa adwene mu.
Wadwene mu.
Wadwene mu brain mu. Won se nipa te konkura no. Se wotwa mu a, wopai mu a, akoto nipa na adwene mu.
Okay.
Na adwene no so no brain ni control o body ni nyina. Brain ni part bi e friend brain stem no ka bo mu a. Se me ka say me bie ma no a adwen no na e control say e kwa me bie ma no
yeah
se me bie mani ahwa ade o se me meni ade o se me pija me nse o me pija me naye o se me dwene a ana se me ka asem na esisi so a mpempi na na e brain no ana ebua masa nyoma nyina akoso na eto da bia e ka se stroke na sa brain ni etese nipa bia no nipa wo ho enu hi aduane uhi ade bi won fa mo me friend oxygen brain so one of the key structures in the body no ehia sa adwen ehia sa aduane ne oxygen no
okay
na ekwa fa so enya ne say ade bi ekọ adwen mu efe no intini their vessels e bi be ka say dropping enti sa vessels na ekọ adwen mu no ona eto bia na eho akoto chima kakra eto chima na ma adwen no aduane ese onya mframa ese onya no enya enti ni nyina akọ akogina adwen fa sa problem beba se koba se adwen no o se nipa wa adwen no control different things se koba se adwen no fa e control e bi ase de wo kasa no na e affected da na de se nipa ko na wonya stroke no de kasa na e bi ansesan kakra bem se koba se bi ebo ama wotumi nante de ma pija ansa na ansesan ba bia enti depending on part or a brain e be affected no enti se ka se brain aye medical e be ka se e acute or sudden onset neurological deficit neurological deficit say me to me pija me say me to me pija me na me ade no na enam say eye intini mu sesan bi aba say bi ensina kosi wo baabi ana say ensina pai baabi na de ba nti no ko ba yesi ni pakro no enya stroke no nti yetwi kasem de say de ka stroke ne de me nhye de nim say de ka no ne mu de ka akokosi ne say prekope no di pakro na anka otumi koba ana say otumi dwene otumi kasa otumi ye bibi no prekope no sesan bi abem ade kontra ontumi nya ne say wo mu say ne nan no ontumi ntu na mu no adwemu nsesan aba intra na ama entumi ontumi ntu na nan no na adwene de ebe na ma nsesan ne ba mu a yesi enti na ekwa adwene mu no ana prekope no se bi ne fa ba bi ablock ana se akwa akopai ba bi enti ama adwane yesi adwene nya no entumi nya enti na very basic form no I can say stroke as any actually.
It's interesting so we describing it as sudden.
Yes.
And acute.
Exactly.
And bo koko say wadwene enya oxygen. And can't chire wa nipadua ne say minya mframa o. And can't chire nipadua ne say oh. Na say aduane ade ma me no insufficient. And inti no me bo koko. Why is it sudden? Does it not give you some signals that this is what's happening in the brain?
Okay, so stroke dey acute and sudden has to be established. Nemo ade kofa stroke ba no ebetumi amma o nkaibo kakra. Ninti wadwen be wo say bi asade a me wo ninti mrek say menya stroke na yede akosro. Nti bi na nipa kro no ye say ye me sure say bebobo so dey be na di stroke ba no. Say bi nipa kro na hypertension e wono so. Ninti ama nya stroke no. Hypertension dey betumi ama na da ne ho adibi bi ana niti edwa no niti pa no. Ana say wo mu a oje ahome ya de kakra bi anu abre. Etu anamo say saade na ekofa stroke ba no. Ebetumi abonka ye kakra nti so wantu ho anamo a ebetumi di stroke na ba. Ba stroke na mu na eba ne de ye prekopa de na eba. Suddenly saa ade na ekọ adwene mu no a block bibi bi a koto bi ana clot bi a wo baabi enti ama mugya no ntumi ndi afurisa ne nkọ adwene mu baabi ana se mugya no apae wo baabi enti ewu se ekoduru ho no ba ntumi enkọ adwene mu se de ese ekọ no enti ne se enti na mansesan bi abew no.
What causes the stroke? What chechemu aduane mba inframa mba, but what would cause inframa not to be able to have access through the veins, and our vessels, into your brain? What causes that?
Yeah, that's a very good question. Enti stroke no mpenyi so you see you two main types. Other ones, but your free BB ischemic stroke.
Okay.
And you see hemorrhagic stroke. Ischemic nature says said the moja na ekwa adwene mu no prekope no aswate kakra ana ntumi nkọ adwene mu said the say ekọ no. Ana hemorrhagic nature say bibi akopai na moja no akọ baabi enye say ego. This are thing. Ede be na cause sa enyoma pii na cause ba but eya na empempi no eye condition bi a nipa no wo ne body mu dada no ana ekwa akofa ba nti oba ye bibime mu hona the main number one cause of stroke eye hypertension mojam so
okay
wo ebi say BP edi say wo mpo friends pressure ono ne number one cause of hypertension in fact 9 out of 10 there obehwe na ebi anipa ko no blood pressure bi wo ho it's one of the main cause of it ading enkwada nche na ebi na anipa ko no other condition mi say owo esiche yare diabetes ebi ana anipa ko ne cholesterol level won ne body no e wo soro nti srade na e woni anipa ko no ntine mo ni ade no ebi e wo soro e man one of the major causes of stroke no another condition ebi e woni anipa ko na adwen mo say ebi anipa no akoma yare ebi akoma yare ma akoma no embo se de ese ebo because akoma na pompi moja akọ the parts of the body and asa akoma yare bi e ama akoma no ebo enso se de ebo no emmo no se de sisi so no ebo kakra na eja kakra na ebo se ni ade a esa na etumi ma se bi clots ekoto bi e form wo ebi akoma ni mu na afi de pa na akọ intini na ekọ adwene mu no na ma na block kakra betia ba se ebi anipa kro no other medical condition bi or what say ebi or kidney problem and I say free bibi uric acid or ade bi e cause gout and so what that ebi asa nwanyume wo so nyina na e man the risk of getting ebi asa stroke e koso ana se bi ono fa sa medical condition when the pan ho ne to nchen a ebi ana nipa kro no ne ye bi ni suban bi a nipa no oye inti emma ebi a risk factors yi ekoso ana say ni directly cramp emma ni stroke na ekoso ebi a number 1 obi onom cigarette obi wo ha daba ko say cigarette no antwe be say pack be say de wo ha etumi ma ni pakro na risk of getting stroke yi ekoso ebi a ni pakro no wo onom nsa obi betumi atena ho wa bomb into papa into pi ni nyina no etumi ma risk of getting sadi de ekoso ebi ana nipa kro no onkeka no ho ebi afa kotena beebi ese onante ko na onante okoduru adwumu a beebi ese nko floor staircase na oba use lift no waduru fie no so no ese ebi okeka no ho weekend bi akodi agro bi no onkeka no ho no enti inactivity no ma o risk of getting stroke no so dey ekoso ebi ani nipa kro no stress e wono so. Because the point is that your lifestyle and your increase your chances of getting hypertension. And already established hypertension is the number 1 risk factor. I have a chance of getting stroke no akoso. In Zanyo hypertension ni akoso no invariably no so a risk of getting stroke is so akoso. Into inactivity, into sedentary lifestyle. And I say be the pakro no weight gain. Ko fu ye kese na say first na me ka se ni biem by pi no they be ka se bi nipa no ye kese na che se odi but enyoma sesa but wo ye kese ni na ma o risk of getting sa anwanyoma ye de kosoro other lifestyle see e bi aduane nipa di nipa bet na ho na aduane odi no enchi na owiase nyina no obedi aduane ba ko odi no for ya wo ye no e bi a ko bi kakra wom omoni kakra wom o de kiwi ya wo no enko wie kra mbo no kwotena ho so wodi a say bia o de kan bibi na adi ho anyoma bia nka betu ye nchi na free nti man the risk of getting that adi so ekosoro other lifestyle so betu man nipa kra aduane die so ye ka se ye ko ebe ko bebre e bia time a nipa ni didi emra obedi dodo no obedi no e ma risk of nipa kra na nya stroke no ekosoro ana se bi lifestyle bi a nipa bi so afefa wo ho obi wo ha se bi cocaine ne amphetamine ne heroin ne nyomanyoma ya nkofo yeye no aha oni nyina so shisha no so ni ade ika no e ma risk of getting ABS risk factors yi ekosoro aha enti wo hwe mu a ana ankonye che ne bi kwa na nipa ko no eye eduro bi a offer for a certain medical condition no so no betia ma nipa ko no risk of getting a stroke na eden akosoro ebi a owo problem bi won body mu ebi auto immune problem bi intine say intine ebi a nipa ko no ye say onfa eduro bi e beboa ama ne body na fight na on abafo no betia ma no risk of getting a stroke ya eden akosoro inti wo hwe ebi wo so na ebi a inti several factors
now my concern has to do with the age cohort that is likely to be affected by sad disease way. Because me sure me in the it is so being a stroke. That's only film.
Exactly.
But and then 18, 20, 25, 30. And these are people who are active. And the boys you are so much to the car or buri wako jog no aba. But when you bet in see oh Charlie, this guy he gets stroke. How is it say area na eche empenyufo suddenly a chinko da wo mo ye active?
It's honestly a very good question. But the essay established and say emra sesana emra dani. Say be first na adwuma nipa ne body bread drew baby and san why no is a younger person no. Stress level bi kumukra no esna de panyi bi abone bread wie kra mpo na ekoso ade. Efa kesiye ne obesity you know, it's one of the pandemics people are putting on weight because of bad eating habits. As I say about we are saying urbanization say be we adwuma wo kaswa or tebi atema nti so sorry ahomachi obetina ka mu a be traffic mu obekwo na adwuma no say so kwa potena ho adwuma bi a very stressful ade obewie obetina ka mu a be ndi akwa koduru fie anwumre and that time na so didi ansa no wakwa poda ne ade nti all these things now culminating in the person no the risk of getting some of hypertension diabetes cholesterol level ni na ekoso na younger people no we are being exposed to it and in fact sedentary lifestyle no so right now no you can see say cholesterol you say no na say how often I say bia wapon na say or 5 ichira kwa kobobo bi fajo ho obetina dem aboni game about 3 hours, 4 hours, we whole board game in TV. Into a money panel can hope into younger people, no. Those risk factors now can naturally and exposed to no and being more exposed to it. And in fact, before nanka hypertension, for instance, a disease of old, say bianca nipani nanka in tineness be more mojan to be near for son said no. And Casanco for Nabianco Muninya. But now no younger people in the younger brackets, they are getting hypertension. We make here a point these same people have been going up and down or for people no near. But it should be established exercise is just one arm of how to prevent stroke near. It may happen in the parkour or for Okoba. But you are wabbit now be a name one a boss in no. The same person that same person always that same person will go up and down so no is a person who is book call lift in a year stress we are seeing is that same person who is being subjected to as younger people no if you realize that our health seeking behavior no as compared to what we are is done near you me ko ama wan na be hwe nkra ni nyoma no nti emma you become more idea particular about your health no nti emma bibia ni a o tu ho na mo ni ade but there are younger people many people living with several medical conditions because they don't go for medical checkups in ade no emma omom peke sa nyoma intem nti be hwe very young person na bia na BP no e wo soro pa onim da preoccupy say irrational na on the fum kino. So, the risk factors now money per to minya a stroke, you know. Younger people now are being exposed to it. Younger people they are not going to hospital in terms of the Somokono. Into a ma and pain and your mana a man of Fabani, who in 10 years here and them. Into a ma these people are getting these conditions.
Are curable?
It can be managed. So stroke no can be managed and the outcomes are very good. depending on time the nipa be no.
Okay.
So bigger stroke won say yama yenyanti ase say eye entina ede moja na ekọ no ana ebia kotoa clot bi abo baby a enti ama entumi nkọ no ana se moja na pai wo ho no se nipa kro no eye no na otumi ebedru hospital ntemu a because se nipa bia no sa brain na ye ka no enyoma pii na kabom ye brain no there are several cells a kabom no hwe mo ache se nipa no se wo brain no e deprive of oxygen eni nyoma e hia no every minute bia no you have 1.9 million of these cells no ewu every minute and he tells you say e bia nipa kro no e deprive of it na se nipa no tu ho na montem na etumi ho se e bia ye clot here Odu hospital ntema etumi reperfuse through several means ebi betia mo aduru a se yehwe na se nipa na dia no contraindication a etumi mo aduru a ebetumi ama sa clot na aform wo ho no ebetumi anane clot na ama moja no akwakoya ade ba nipa ne tena hwa ma sabi die nsesanye na beba adwenma aba wie na afede sa clot no koyi krampo na problem na eden damage na has been caused already ebi also a bia na intini bi na apai wo baby a ne ntise nipa ne bantem na utumi ekọ emma you can obetumi correct this problem na abaho no but having said that no ebi wo no so a management of stroke no so no apart from reperfusion no let's get it impimpi ni ane ya no koso se nipa no hu stroke ntise na abamu a kire se nipa nya stroke na on rushing ba hospital no we ade die akoma so ade atem bia na epesi e preach because sa oba ntem na ma outcome no brighter because sabi nipa no eba sa other comorbid conditions no wo ho no e bia time onya stroke no e bia na ne sugar no wosro e bia na bp no wosro e bia time oba na ne temperature no wosro e bia that time na ne sugar no won no adna sa de no tumi pantem na ehun ne ntem na you to be treat these problems in na eboama outcome of stroke no very very good patcho so ho say eventually cry be man with some disability crampo na eboama sabi emma disability na eba form no ba nipa na mantem na sabi odi chini odi faha ono a ye won say Ghana ni adi won say sabi na no chia won say bia ne nsa otumi mpagya won say bia na no kasa ne mfa na nipa ko no still out fear patcho say by the time ani pan beba na bia den sepemi aba inti stroke can be managed. It can be very depending on when it comes, and you can establish reperfusion ama the person may go back to the usual self no and I say ubi ho na e kabit me managing a disability na edbema no disability say edem na edbema no se nantie kra no ntumi kra mpo na e betia managing the sector e beboa no ama sabi e kwan a nipa kro no physiotherapy ni ade beboa na ma ne nantie no e betia ya ade say bia nipa kro no psychological effect na stroke na betimi ama no the clinical psychologist wo betimi aboa no ama na tumi manage say the occupation e bia nipa kro no or ye right handed and left handed na stroke na aba ni nti ama ne nsa right no ntumi mpagya na the occupational therapist who are there will be to me abuano say how do you go if probably you are not ambidextrous won't mean you so hands no with ease it will be to me abuama say be a kwan will be to me I'll go through some of these problems no e be the spiritual support no we can give that person e be a dietitian no we can help that person and stroke can be managed multidisciplinary way enye ba akofo ade.
All right, it's interesting that you mentioned the physio aspect because I wanted the conversation to dovetail into the physio aspect, but keep in mind say the baba issue all this while work asane nyina was you so bantemu a bebre nom de ahye ho nom tifi omo ntifi omo ko herbalist so ye ba ho asem but Saibu physio na ya doctor for ne kase yen ko physio na yeden
so basically Pacho Mesro make a
it's fine so when we talk about physio, what is it?
Yeah, so physiotherapy is basically, as to break it in terms, is physical therapy. So what it means is we are using physical agents in order to treat conditions. Okay. That's as simple as it is. So what you do is that it's physical agents. It can be through exercise. It can be through what we call electromagnetic stimulations, or it can even be massage. As people, even though a lot of people tend to link physiotherapy directly to massage, but it's not just massage. So it's a lot of physical events that go through in order to treat patients.
So what key role does it play in the management of stroke, as Doc just said?
Yeah, so physiotherapy is very, very important and it's key. And as Doc was talking about in terms of the time, we will say precious time will save mobility. The precious time saving mobility in the sense that if you get a stroke, you have to start physiotherapy as soon as possible. So the stroke is just an event, as doctor said, it's sudden, it has happened. After the stroke, what has happened? It has happened. But after it happened, what is next? What do you do next? The next thing to do is now to save the life. So you get the stroke, you have facial drooping, or you cannot talk, or the hand is off, the leg is off. That is when the physiotherapy come in. So the physiotherapist will come in to take you through facial exercises in order to help reform the uniformity of your face. The physiotherapist also come in to take you through exercises so that the hand strength, it will come back. Physiotherapists come in to strengthen the muscles in the legs as well, and then train you to walk. So the physiotherapy bit is what is actually going to deal with the effects of stroke. Because stroke, as we said, is sudden. So usually when even we don't have what we call stroke patients, they are now stroke survivors. Because the stroke has happened. It's sudden. It's just about a second of event that happened in the brain. But after that, it comes out with manifestations. It's the manifestation that we talk about, weak muscle. Or he's trying to raise the hand and cannot raise the hand. Trying to smile, but the smile goes towards to the left side. Trying to get up and they end up falling back. So that is when physiotherapy comes in to strengthen these muscles and get them back to moving.
Forgive me if I'm probing too deep with my next question. So here is the case, the vessel that goes to the brain, that is communicating to the individual's arm, that when somebody is giving you something, raise your arm, is blocked and is ruptured. And so the blood is not going, that particular line is destroyed. How then do you use physiotherapy? Seeing that the communication that is going to the brain to tell the person, lift your arm, is no longer there, that avenue is no longer there, so that the person can now begin to lift the arm. How is that done? So
that's a good question. So it uses a principle we usually call neuroplasticity. So what happens in the brain, as I said, it has happened. And I always give this very basic example. The brain is like this. Then we have the left side of the brain, then we have the right side of the brain. Now what happens is our left side of the brain then control our muscles on our right side. And our right side of the brain controls the muscles on our left side.
Interesting.
That is what happens. So what happens is these two sides, the stroke can happen on the left side or it can happen on the right side. That's why mostly, but not always, you will see that it is one side that is affected. So when your left side of the brain is affected, what happens is the muscles, the neurons, we say neurons, that actually send signals. Before you, like, I'm trying to raise my hand up. Before I think of raising my hand up, there have to be an information sent to the brain. And when it's sent to the brain, I want to raise my hand up. And the feedback will now come back to help me do that. Now, when there's brain, the stroke happens and there's sudden loss of blood to that side, which will cause that particular place to be affected. Now, what happens is you have to train the rest left in order to, so for adults, we don't have regeneration of brain. So what has actually been affected, you are not going to bring it back, but you are going to train the nearby neurons to take up the roles. So usually I would tell people that it's like you are in a house of two. Your brother, you are two brothers. And unfortunately, you have your children you take care of. Your brother also has his children he takes care of. And unfortunately, your brother passes. Now, if your brother passes, you have to take care of your brother's children in addition to your children, isn't it? But sometimes you tend to forget about your brother's children. So you need your brother's children to keep knocking at your door in order to signal you, to prompt you that no,
we are here.
Yes, they are still here. So what happens is it has happened. Feedback is not able to send to bring back an event. So you do one stimulation. So we have electrical stimulation in order to send an effect. So you do a stimulation and the hand is moving. But the brain did not sanction that particular movement. So when you do the stimulation, what happens is it also sends feedback. And that neuroplasticity, that principle of neuroplasticity is what helps for you to gain back the muscles. But all this is about time. Because what happens is, as I was talking about your brothers, what happens, the more you delay and feedback is not sent, you are not able to reconnect the neurons back. So it is just about repetition, repetition, repetition. So you have to keep repeating that movement. And when you keep repeating that movement, then you send signals to the brain. And that helps to improve the muscle strength.
Well, on a normal, successful assignment of supporting a stroke survivor to, let's say, be mobile again, how long is that period? I'm saying successful on a normal case that is before you. How long does it take?
It varies. It varies, due to the age of the patient. 2, it also depends on the comorbidities. So there are some patients that come in and they have other health conditions. Usually that reduces the intensity of the exercise and the sessions you go with the patient. Another thing too is the impact of the condition. So what happens is, in the muscle, the way we grade muscles, we grade muscle by over 5.
Okay.
Everybody has 5/5 in each of the muscle they move.
Okay.
Somebody can get a stroke and it's 0/5. Somebody gets stroke and the muscle is 1/5. Others get 2/5, 3/5, 4/5. So depending on the effect that happen, would also give you the prognosis. That is how fast you can get recovery. But most patients will only say that the first 3 months is very key. The first 3 months of stroke is very key. From the 3 months of stroke, you should, if you start early, you should be able to get the patient moving. But averagely, usually within 3 to 6 months for the minimal stroke case, you should get them to close to 90% recovery if it is a minimal stroke. But if it is quite a very bad stroke, as we will say, that means that person came in with 0/5, muscle trunk control is bad. That means they cannot even sit. So just to let you know, it's not only the hands, it can also be the trunk. So somebody gets the stroke and cannot sit without support. So all that, if it is that intensive, then that means that you need about 6 to 1 year to get complete to full recovery.
All right. Our time is really, really far exhausted. But, Doc, the point I was making about what the Okatri, not maybe make Kase. What's the one motifi no momentum? But I know I'm not you. Nipano, any idea no? Yes, you do you be or Hanum say ya? Herbalist be or Hanum say ya? One day what being was struck mupa. And because of previous experience of somebody who has gone there and it's worked. Yet you only panel alcohol honoma or banana because we are 19 years you and your local herba a most of the times we resort to herba before we come to you. And also no
Okay, so it would be wrong for me to sit here and my preacher say the only way I between a treaty stroke a year through a year, but the many yesterday near who need to meet who had man who say a give results a year what a beer or hospitals near the no so key says any chrono stroke no in yawa sadia make us a clot and abba a bit me I establish reperfusion say nipa no one back within 3 hours going to be able to stretch out for 2.5 hours and that's all later now it's the beer sometimes the outcome is not too favorable. Why the people will go to, why we insist, say, I do appreciate why people go to other places near the, probably because they've seen people, almost don't go for munya sa results, but the America can say, or more healthcare, not make a different rough territory. I'm trying to carry that.
From territory.
Omo ba stroke unit ne omo ba medical centers here wo ho ne ade no. Eboa pa de meka ka me nya de o kan se brata me. Physiofo mo ade ne so key eboa ma ye healthcare ne ekostroke pa. O se bi metiwe mi nse yi no se egogo na se mintumi mpija. Na se ma nye anke ka me ho se meya pija na ebeduru bi ne nsa be din titriti.
Yeah.
Afide me bie me nsa mekra mpo na MBA. It is the first nka metumi etne kra ma ne yesi na. Afide enam se mintumi enye na nti no afide bosa na nsa na ye din sei. Pacho ho. Afide nipa ne nsa na ye sei ne ade no. Nti bibi kra mpo no kotumi fa first na enya ade. Nti na ade no ye na eboa prevent contractures no. Nke bi ebe ma ne nsa na ye stiff ne ade no. Aha ana aditi mo ade no so ye so okay ne se. Wo ho mpepi na ya na stroke no ye di ko mo ye other things na ye omo no. Ebi ana nipa kro no ekuro bi efre bi be toss ebi a stroke na aka no abona to ho ompija no ho ne ho nkeka ba bia no se medemensa sei eto ha sei for a very long time na me mpija and am sa two surfaces na ebi I can't together for a long time no most of with time na then ekuro ba ekuro no suba na e change the dynamics of what we are doing so when they come in na eboama adepa yi other ade epa no empepi no yana nipo wa adwen me se me nan me ntumi ntu na se me kɔ na se eboama me ne kra na na de bibia ye no ba hospital na beyond stroke na wanya no so no we are thinking about how do you prevent another stroke nti ye say be hwehwehwe mu aboama sa anwoma na ekofa stroke ne ba ye no o pressure na wo na e be make sure so be straight pressure no say ye o esichi yare na wo mu e be try say be treat say be our cholesterol level no so na e be boa na treat cholesterol level no some other things e mane buy na e bitumi aboa ma na ya the dietitian na wo hi e be mo anya pacho ho nti as we are preaching this year no you see precious time it's all active fast nti you nimo you acronym say the mankofo in fact ye ka kokwa nyina na ka kosi say you need to spot the thing very early o spotting in them na no 200 more o say na made na spotting in them you say we need bibia no fa di we 2 3 me say be fast BEFAST B ni che say balance oni obi tifie na afie ni pako no otwi ne na ase ona otwi ne na ase o say enyini na onyini na enyini bia na wani pa etwi ne na ase na wo si nipa me wo ho na afie de say bi ni pakro no opese ogina ho na afie de say obaba ne nemu ansa na watumi anante na o lose ne balance na wo si nipa ne nante ase afie o chia kofa bi na the balance ne hye de ni wonti bi no eso wo say bi a stroke no ede onya onipa ne te ho adwene boa ma wo hu ade yi na nipa ate wo na afie de prekope wo hu ade tutu anasa ade a wo hu ya so wo hu fa say ni ade na bitumi aye sa stroke no nti no wo hu sa eye symptoms na make sure say bi an stroke to ho na montem ye tumi aye hu ade yi sa fast no efo no che say face no nipa kro wanim wote ho na afie de say nipa a wonim say na nim na street afie de okasa na no na echia afie de nipa na okasa aye say odruli saliva bi aye say okasa na nti aye say otinwa we say na nim no enhye de nsisi say de esi na bia na stroke yi na eba no ese nipa kro no ede otu ho anammo den eye bia na nipa kro no arms no afie prekope wakwa adwuma wo tworo afie de wo say tworo ya afie de me yes wo ya emma ana se nipa ne okasa opese obo ne nsem o yese ha afie de say we nko na ebo left one into me mo na ne arm no bia opegya ne nsa sei afie wo say ba ko na ne into me nyina ho na ekofom na ne arm no wo sesase no me ntina fie ne nka se bia na nsese bia ba adwene mo no ba bi na agwo enti o say akọ ana se nipa ko no say na speech no bia eba wo bi se nipa asem na kofi ko hen afie de asem ofa no na ba bi bia na asem na wo ka no onti kra na otun ama ho ansa no bitumi so aba so se nipa kro no waka kofi ukọ hen afie de wo so opeso ka na afie de kasa yi se kasa ni ntumi ma ana se o kasa afie de se o slur bi sa nipa kro nyenso wakọ abroche bi na aba na ma ne kasa na preocupa wo ze nipa kro de kasa na se de enye ade a wote ho ama nipa kro aduane afie de wo aduane o boy afie de ntumi nkọ ne ade na enti personal speech ne sesa na bia na stroke na ebo nkwan we enti ekọ nyina na akọ akoduru sa time na ade aba no ti no ment na fie enye se me to afa ha me twen we me ye ti no sabi abrochire no ambulance system ni very efficient. Ghana so ye boy home de pa but won say enye ndru ho. E catch us say 3 hours don. 3 hours now the free fee ba pedru ade. Nti bi afi na akwa han, akwa free taxi, akwa free boat, akwa bi say din ade no. Nti the bottom line is let's put these nyoma in term no. Na seek appropriate management. Na oba na ade ye ma hospital ni e ka se ye mra no. Ma me sisu dia na say oba na ye free multidisciplinary care. Nti stroke unit amenwa e wa adwuma no. Okọ na nipa ba ko no. I say wakọ hotel package no so. Ba me package no so.
Okay.
Nti doctor ba behwe neurologist ba. Neurologist na ba wie no say o pressure no wo so doctor hwe pressure ba behwe wo wie na dani da nyina dietitian ba behwe wo say aduane asi nipa yi no nipa na wa ba hospital ba ko no all this packaging e dey ma wo be wie no so you have people there clinical psychologists ono ba beka bi a okunu bi na etete wana say oye bi na etete wo ana say obi djuma bi na enkoyie na they are there to help you. Nti wo say na me wie na me kwa adwuma e be de na metumi akwa adwuma occupational therapist dey come in handy to help you. In fact asofo ni ade ba ho ha say bi a wo no frɛ onyame ana say bi a ade a they can help you to ade. Nti misre wa ye ba hospital na package no so ana eboa ma outcome here very 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 bright.
Yo, ya be no ayebe Henry, na pe medo ase.